मुस्कुराहट का राज छुपा है दांतों की हिफाजत में, जो दर्द को भी मुस्कान बना दे, ऐसा हुनर है इनकी तिजारत में. Ladies and gentlemen, I am proud to present a celebrity dentist and aesthetic expert, Dr. Hajira Nazeer.
Hello. That's really wonderful intro, Fez. It was really nice. Thank you so much. I appreciate, because the first line which came out was really nice. Otherwise, every single day I get to hear, "Oh my God, I'm so scared of the dentist. Please handle me with care."
So the first thing which I want to ask you, deep down, hand on your heart, right now on a scale of 1 to 10, how nervous you are?
Hand on my heart, very.
Oh my God, I'm so happy today. This is a sweet revenge against all the people who've been sitting on a dentist chair and being scared. And I think this is a sweet revenge then.
So I just want to know, what is it that you guys perceive of dentists that you people are so scared about them?
No, I have a lot of respect for it. I mean, there's no denying that. But imagine, I'm sitting on a chair which is like, torture chamber kind of a chair, and somebody is going to put something really sharp in my mouth. I am going to be scared.
See, that's how you, like I said, it's perception, right? It's just because you have heard stories, or you have, learned from your ancestors that they've had a scary extraction, and there are a lot of myths. So that's how you end up, having that, scare for the dentist, right?
So I think if a dentist can promise me that everything is going to be painless, then I think it could be different.
Yes, of course. See, like I said, modern dentistry has evolved so much from, what we had. Like, we used to, there were instances where, back in 1980s and back in 1940s, there were barbers also who were performing extractions. So people have that thing in their mind that, we are going to pull out their teeth without anesthesia. Come on. That's not possible. Now, when you see modern dentistry has evolved so much that we have something called as painless dentistry.
But even if you were to put anesthesia, and I mean, there is going to be a prick, right, for the
There
injection.
is definitely going to be a prick. See, there's no denial about it, but definitely there are certain medicines that we apply to make sure that that area is completely numb, and then we go in, right? We are also humans. We are not butchers to just go in.
Thank you for reminding us. But for me, it's like always we picture them that, koi aake aapko attack karenge.
Okay, let me just ask you, do you think, have you had a bad incident?
Not honestly.
Right.
I feel that I've been very lucky that way. And I think, dentists also know that how intimidated people are. And they really treat you like, probably I think you must be having a notion that, even if a 60-year-old person would be coming to you, you might be treating him like a kid.
Absolutely. See, we, as not only dentists, but all doctors for that matter, we see our patient as kids. We have to treat them as kids. So because, there's something called as psychological anxiety that they already have. That I'm going to a doctor, I'm going to a dentist, and, they are going to do this. And of course, there's so much hype on social media that there are wrong instances and things like that people have been influenced by, right? So we need to understand the entire psychology of the patient, treat them as per how they want to be treated. I mean, that's how I work.
So let's take a few steps backward. Now, what I see being a dentist is like what sales is to a marketing industry. Generally what happens is, if you are in the field of marketing, nobody actually wants to be a salesperson. It's only then that you get into that and you really get the kick out of it and it's fun. So being a doctor, my assumption is not who wants to be a dentist actually that, wants to get in
I would say, nobody. If you ask my 9-year-old boy, even he wouldn't want to be a dentist, even though having a mother who's a dentist, right? So, see, the thing is, even I didn't want to be a dentist, to be frank. I wanted to be an architect. I was pushed into this line basically by my mom. Okay, where she just dreamt of me being a doctor. So, be a dentist, she said. Because it's more of a convenient line of a medical fraternity.
But eventually you became an architect, a smile architect.
Yes, I am a smile architect and I'm proud of it, Literally, because I'm proud of it because I know that, I'm not just bringing in aesthetics, but also helping people functionally, who are able to chew or even do betterment for their life.
For the benefit of the audience, you are not limited also to being a dentist. You're also, you run an aesthetic clinic.
Yes,
So
because
more on that.
I'm also a cosmetologist, and I have done my aesthetic medicine from Germany. So yes, so that, see, it's like when I was a dentist, like the dentists are just not limited to teeth, 32 teeth. We definitely, we literally, go into your facial aesthetics, right? A little bit of enhancement of your lips, a little enhancement of your skin. It just gives you such a beautiful transformation. Don't you think so?
I agree, but right now, because of we are living in the world of Instagram and social media, and aesthetics are so important, and there's no denying that. But in the process of wanting to have, capture the perfect look, people do a lot of things on your face, and these are all artificial methods. And I'm so glad that we have you here, because my perception generally is nothing like being, having a natural beauty.
Okay, Faiz, let me ask you a question. Okay, I'm so sorry. I know this is your podcast, and I'm not supposed to be asking you questions. So Faiz, tell me one thing. Why you dress in this attire? I mean, why? Why do you want to do makeup? Why do you want to groom yourself, look good, right? Why?
To be at your presentable best.
Right. It's like a necessity for you, right?
Have you given me a compliment, by the way?
Handsome man, yes, of course. So see, you are dressing up certain way, you are grooming yourself certain way, because you know that this is necessary for your job.
Absolutely.
This is what you have to look at your best, be presentable in front of everyone, right? Skincare is exactly like that, right? Like how I wear makeup. I don't think any of my patients have ever seen me without makeup. Not that I look scary without it, but
I admire the honesty.
but see, why I do makeup? To look presentable, right? So that my patients don't get scared.
But don't get me wrong, see, it's one thing to apply makeup or something like that which can just be washed away. I think, and even the way I dress or something like that, I can always make myself comfortable, and nothing like being in your pajamas, right? I think at home.
Absolutely.
But honestly, when it comes to, putting injecting your body with certain chemicals.
Everything has limitations.
Okay.
Everything has pros and cons.
That's what I want to know.
Right.
Tell me something, where do you draw this line?
So, see, exactly. Now, Faiz, if you see on Instagram, there's every other influencer, there's every other person who's trying to be an influencer, who's telling you what you have to apply to your face, right?
That's scary.
And that's really scary, because what, you are creating an unfiltered expectation, right? And tomorrow, if say a 13-year-old is looking at an influencer's video and she just applies retinol, or she just applies whatever she wants to on her face, and she thinks that I'm gonna look as good as the influencer, like I said, it's gonna give you just the unfiltered expectations. We are doctors, we are literally sitting here to help you every bit, right? So why not just come to us? We will definitely guide you. We are not pushing you to get I personally won't push my 18-year-old patient to get a dermal filler.
Fantastic.
Only if it is required, right? A Botox, why do you give a Botox? There's so many things that comes into the picture. You have wrinkles, you have skin sagging, you have, fine lines. So we add Botox because it's just a neurotoxin which will help you to, refine your skin.
No, I'm glad that we are making such a responsible point here, that at the end of the day, with anything which comes to health, if you are taking advice, it has to be from an expert. It has to be from a doctor.
Always.
And I think today every doctor is actually also, sorry to say, but terrified of ChatGPT, because by the time, see, earlier, people used to Google their stuff, wherein at least you had multiple answers. Now ChatGPT is giving you one answer. So is it something which bothers
see,
you?
I'll tell you one thing. ChatGPT, how do you think the internet gets its point? ChatGPT is a part of internet, right? So you are getting these points by the doctors, from the doctors, but it's just experiences also from the patients, from the people, right? So ChatGPT is good for education, Definitely, and you get to know exactly what exactly is being done on you, or what exactly is your problem. But ChatGPT is not treating you, boss. You need to understand that. You need to come down to the doctor, and the doctor will explain you what exactly you need.
As a doctor, what is the biggest challenge which you face? And you are like, ye to hona hai. I mean, there should be something which you are like, you need to educate your patients that this is where you draw the line in terms of, getting self-medication is actually a very big problem already, even before ChatGPT. And now with this,
That's it, because like I said, experiences, right? Right? So you get fever, what would your mother do to you? She would just give you paracetamol, right? But do you know that excessive use of paracetamol,
kidney problems,
kidney or liver damages, and there's so many things that you even end up having gastric issues, right? But that's the whole point. So it's
Dolo
just
650 has become a part of everybody's diet.
That's because of the COVID time, right? Because people used to just pop in Dolo 650 like it would just cure them. But how did it come out again? Again, we have our social media, right? Where everybody is sharing their experiences, telling us, what to eat, what not to eat, have this, have that, have vitamin C, have zinc, have this. But do you really require it?
No.
Do you know?
Hajira, you mentioned a very important thing about Botox. Now, the issue is that what I see is that there's this, thanks to Bollywood, there's so much of influence on everybody wants to get into Botox, rhinoplasty, and all these procedures. First of all, how safe are they? Who should do it? Why should you get it done? A little bit of that.
See, like Fez, before I kind of told you, I'll tell you what. See, now when we are talking about Botox, people have this perception that Botox is just gonna make me look like Sushmita Sen or Aishwarya Rai, things like that. But what exactly is Botox? Now, Botox is basically a neurotoxin that paralyzes your muscles temporarily for 3 to 6 months, right? Now, that Botox has been used from ages in therapeutic medicines. Like, for example, we used to use Botox for migraines, for your muscle toxicity. Okay, so there are a lot of benefits when it comes to Botox, but again, there's also limitations, right? Botox treats your hyperhidrosis. Hyperhidrosis meaning you're sweating excessively from your palms, your underarms, right? So all that. So there are things with Botox does, therapeutic as well as cosmetic. When I come to cosmetic, it's basically treating your your wrinkles, your fine lines, and making sure that you have a good skin regeneration by tightening the elasticity. So just imagine I have a muscle and it just gets pulled. Obviously my skin gets tightened.
Exactly.
Right? So yeah, so Botox, again, Botox has limitations. You can't just, not everybody wants Botox. A doctor will not just suggest you, if you go to a cosmetologist, esthetician, or even a dermatologist, they will not just tell you that, madam or sir, you need Botox, right? We tell you based on what exactly, is your problem, right? Every medicine has to be suggested according to their symptom or to their problem. So an 18-year-old coming to me and saying, doctor, I would want a Botox. I would first analyze and I would be like, do you really require it?
Absolutely.
Right? So there's a lot of perception about Botox. Again, like I said, thanks to social media, Bollywood, Hollywood, everywhere we just hear saying that, क्यों आप जाके Botox नहीं करवा लेते?
But it's like ethics over commerce, right?
Yes, there is a certain aspect of that. But I don't say that, every doctor would suggest you such, right? If you see that, on social media, on Instagram, you're seeing your favorite actress getting Botox done, you would want to do the same thing. Why is she getting done, right? There should be some concern. She's coming on camera. She's in lights. She's doing so much. She needs it. Do you need it? You need to know.
So you're saying it's the demand of the profession?
Absolutely.
Okay.
So this is how, things happen when it comes to your aesthetics.
for the benefit of our audience at the end of the day,
Yeah.
what I want to know is, what are something which we need to think about or need to be very careful when it comes to our oral hygiene?
See, Fez, now everybody here would come to a dentist only if they have pain. They don't exactly understand that oral hygiene is the most important thing. You eat, right? You eat, what you eat is what is gonna cause problems to your body, right? So when I'm talking about, eating, say if you're having glucose biscuits in excess, or if you're having junk in excess, your chips, your french fries, your burgers, your things, everything gets stuck into your teeth. And we being Indians, we don't even have habit of rinsing our mouth after eating. So there are certain things that we can start inculcating in our routine, which will help us on a long run.
Suggest us some hacks like that or tips like that.
First of all, please visit your dentist every 6 months. That's the best important thing, because definitely your dentist is gonna help you, gonna tell you. It's not that the dentist is just gonna tell you that please get an RCT done or get your teeth pulled out or do this. They are always into preventive. Dentistry is more preventive, right? We prevent you from going into such scenarios where you land into trouble.
I'm sure your patients wouldn't mind visiting you twice in a year.
Yeah.
Or do they visit you twice in a month also?
They do, because I am not more of a routine dentist.
Okay.
I behave more friendly with them. Like I said, see, psychology plays the big role here. Okay, it's not just being a doctor. I wouldn't just tell my patient okay, open your mouth, I'm going to check your teeth and this is what I'm going to do. I don't do that. I don't dictate terms. What I do is exactly, I'm like a friend to them. I ask them, what is your problem and why are you here and what exactly do you want from me, right? So like I said, psychology plays 50% of the role right there.
Brilliant.
So we need to be, I would like to tell my audience that, be rest assured, we dentists are humans and we are not going to actually harm you. We are not going to just bring the needles right away on the first consult itself. Please come to us, have a consult, understand what is exactly important, and try to, there are basic habits that they can just incorporate. Just the basic habits like brushing twice daily, maintaining your oral hygiene well by just rinsing your mouth right after you have your food. Healthy food, so that your teeth also need healthy food. They're just not here for grinding whatever you eat.
That's very well put.
Yeah. So we need to understand that mouth is the mirror of your body.
Beautifully put.
Right? So you eat, and there are so many. If you know that oral hygiene is also related to so many aspects of your body, like your cardiac health. Your what you're eating, or not only what you're eating, it's like basically if you have a decay and if you have a broken tooth, or it is basically what it does is it is an opening to the bacteria to enter your body, right? And there are so many cardiac problems which are related to this. That is why if you go to a cardiac surgeon before performing a surgery, they say please visit your dentist.
Yeah.
Right?
So apt.
Yeah. Why? Because they know that they don't want to leave even a microscopic gap for you to get a reinfection in your body.
I actually wanted to understand also that you mentioned somewhere that abroad there's a good correlation between dentistry and cosmetology and everything. So in India, when you had to start, you started completely on your own because that's quite an entrepreneurial journey also. So that must have been interesting.
Okay, so basically, when I was in Dubai, I was just a resident doctor, a resident dentist to be precise. And when I was there, I used to see a lot of my oral maxillofacial surgeons and a lot of facial aesthetic surgeons who used to collaborate and work together. And I used to be very inquisitive, why exactly. Then I understood that we dentists, we work in millimeters in your mouth, on your skin, on your face.
Precision.
Because precision. Now we study so much of our basic thing is facial anatomy. My head and neck is what is my forte, my this thing, right? So that's how we literally go into it. So yeah, cosmetology plays a big role. For me, I didn't even, it's not just because I studied dentistry and things like that, but I even got into cosmetology to know what exactly is the concern and how I can treat and get the best out of what I'm doing. I just didn't want to give them beautiful smiles, but even beautiful face, or even a beautiful look, so that I want to be a facial architect.
That's remarkable. But how easy or tough was to set up your own clinic here?
Not easy, to be frank.
I think operating out of Richmond clinic here in Bangalore.
Yeah, like that people have they are scared of young doctors, right?
That's true.
Everybody would want to run back to their senior doctor. Everybody thinks, and of course, being a female, right? So it was very difficult.
They generally say that you can't trust an old barber and a young doctor.
Exactly. That's what exactly. You can't just expect. People think that young doctors have lack of experience and they will not be able to do as good as an old an old doctor or an old practicing doctor. Let me tell you, they also grew old like the way we are growing old, right? So our experiences, more than experiences, it's the modern developments and the studies, thanks to our studies, that we have brought in best of dentistry that people don't even get to know about. Like we have before, we never used to even use CBCT. We used to use a two-dimensional X-ray, and we would that was just dipping into a developer and things like that. Now, do you see that your dentist would just give you an X-ray immediately, in seconds, right? So
how do they give you 3D imaging and everything?
Absolutely, that's what I'm saying. So see, dentistry has evolved.
Absolutely.
Right, and it's not that
I think it's less scary now.
Yeah, it's definitely less scary because, like I said, you are getting educated well. A patient knows exactly by seeing the X-ray right there that this is what my problem is, and he understands better that why do I need an RCT, rather than me telling him that, boss, you need an RCT, right? Rather than me just telling him, I would show him why he needs an RCT.
My dentist actually gave a very good quote when I mentioned that I was very scared about getting RCT done, and I said that it's very painful. So he said, no, not having RCT is done is far more painful.
Absolutely.
So RCT is being done to ensure that you live painlessly.
Yes. See, what basically is RCT? It's a root canal therapy. Okay, so people think that like for a gynae, they think that cesarean, if she's going to be doing cesarean, she's going to loot the money. If we dentists do RCT, they again think that we are looting money. Now, dentistry is really not expensive. It is quite affordable if you just prevent, right? Prevention is cure, right? So you need to make sure that you visit your dentist. I mean, hardly, how does it, tell me, you go to a restaurant, you spend like, thousands together. Can't you just pay hundreds to just visit your dentist?
Very well.
Right?
Hajira, you mentioned about rinsing, junk food, all these important things. But practically, our dawats are incomplete without the biryani and the kebabs. In a scenario like this, how does one mention this, maintain this kind of dental health?
दावत तो पूरा दिन नहीं चलेगी ना.
बराबर.
करेक्ट.
करेक्ट.
पानी
क्या
तो
खाएं या ना
मिलेगा.
खाएं?
पानी तो मिलेगा.
हाँ.
तो can't you just drink a lot of water
अच्छा.
while you're eating, right? So that's very important. Hydrating yourself,
Okay.
right?
Importance of hydration.
Yes, water, the basic thing. Why do we forget that you need water to survive, right? So that why is water important? It's not only for your just to lose your weight or just do all that. It's also important to hydrate yourself. If you hydrate yourself, you have not only your oral hygiene will thank you, but even your body.
So the doctor says that enjoy your dawats, enjoy your shadis, but
Drink,
don't forget,
please
drink
drink a
plenty
lot
of water.
Yes.
But shadi se yaad hai, I think does Dr. Hajira go to a lot of dawats and
Not
binge?
really. Okay, so I hate crowdy places.
Acha, okay.
You can call me an introvert,
Okay.
right? So I don't really indulge into a lot of parties or a lot of social events. But yeah, when I go, of course, I'm a Muslim baba, hardcore one. So खाना तो पड़ेगा ही बिरयानी, है ना?
बिल्कुल.
But घर पे आके ब्रश तो कर लेना पड़ेगा.
Acha. I think that's a good suggestion. But you mentioned that you being introvert and stuff like that. So you're always focused toward career. What do you do in your free time? What are your hobbies like?
So see, the thing is, yes, I'm focused on my career. I love traveling. So I love traveling because I meet new people and it gives me a lot of experience, a lot of new experience and adventure and learning, of course. Everything is related to my career because मैं कहीं पे भी जाती हूँ, I'm trying to grab that element where I can incorporate that. Like for example, I went to Thailand, I met a monk and he explained me how patient can I be with negative things in my life. So I can apply that even to my career, my dentistry or say my aesthetic surgeries and things like that.
So when Dr. Hajira is not at the clinic or she is not traveling, what does she actually do?
Spend time with my son.
Oh, lovely. Okay.
Yeah, I love him to the bits. Of course, everybody loves their kids. So I would like to tell you that I'm a single mother.
Oh, wow. Okay.
Yeah, so he is my inspiration for actually starting my own clinic because I can see it in his eyes that how much courage he gives and how much confidence he has in him.
Beautiful. Must be really tough being a single mom and being an entrepreneur.
Kind of, but you have to just balance it, right? And I would say that I love my career as much as I love my son.
Lovely.
So I kind of balance when it comes to both, though my son is very naughty, but he gives me a tough time more than my career. But yeah, equally.
So you are your son's dentist, or do you see some other dentists? लेकिन generally बोलते हैं कि अपने बच्चे अपने पास पढ़ते नहीं हैं, तो अपने बच्चे अपने पास मतलब
वो तो आता भी नहीं है.
अच्छा.
But Alhamdulillah, I think to a certain extent I've been a good dental single mother. I can put across like that, where he has maintained his teeth and there hasn't been a situation. But yeah, I mean, in near future, if he has to come to me. I'm so sorry, I have to be greedy.
So to put it lightly, I think if you would be meeting anybody, you would be examining their teeth, right? That would come naturally to you.
Oh yeah, of course, that's my bad habit. It's like the first thing I talk to the person is not look into their eyes, look at the teeth. And I keep looking at that and I'm like, okay, this is what this guy has. He has a crossbite, oh my god, or he has malocclusion, or he has like bad teeth which are stained. So all these things, I mean, it just comes to us.
So that's your red flag in a relationship.
A turn down, yes.
So for the benefit of our audience, to put it lightly, if a person who would ask, to ask you out for a date or something like that. So how do you ensure that, anybody asks you out for a date and ensure that they don't get their teeth pulled out?
I don't think they'll definitely get it pulled out. I'm not such a bad person there. But of course, being a dentist, I would love to have their teeth being perfect, right? And another thing is, as a human, I would want them to, there's a certain point where you can judge a person. Probably I judge them looking at their teeth.
That's scary.
Yeah.
So I have probably a kind of an imagination that probably in your childhood you must be one gunda tomboy kind of a thing. You would have told all the boys that मेरे पास कुछ किरी की है तो मैं दांत तोड़ डालती हूँ or something like that.
तोड़े भी हैं.
Oh my God.
तोड़े भी हैं, because I was definitely a tomboy, because I've been raised with boys. I mean, I have a brother and I had only cousin brothers, so I never had sisters. So yeah, tode bhi hai, and I have been a very problematic child. But I think we all grow up, and then I was more feminine,
I think then you get the best of both worlds, I could say.
Yes, of course.
Hajira, what is different about Richmond Dental Clinic? How is your clinic different from other aesthetics and other dental clinics?
Okay, so Richmond Dental and Aesthetic Center has been brought in, to the patients, keeping their expectations in mind, right? So when you come to my center, you won't just feel out of place. Okay? It's more of a home kind of an environment, but also professional, and we have the most modern technology, right? So we have the modern equipments, and we bring you the best doctors on board, best consultants on board, and of course all the treatments, whatever you want, like that it is more of a multi-speciality clinic that we have. We have ranging from basics, your fillings, to going to your RCTs, to your implants, to your aesthetic surgeries, be it anything in the line of dentistry. We are really here to help you. Again, when it comes to skin, we have the best of doctors who are going to guide you and not fleece you. So we're very affordable, So I think we stand different.
So our audience gets any Icons Unplugged promo code or something like that?
Oh, definitely. Please come, and you can just give a promo code saying Fez Icons Unplugged, and you get a straight 20% discount.
Thank you so much for that. But what are your dreams and aspirations for the Richmond Dental Clinic? What is the plan ahead?
I want to expand it. Of course, want to start with a lot of branches, and want to start abroad. I'm mainly looking at it in Dubai, which I have already curated a plan for.
Fantastic.
And yes, to be frank, I have already started my steps when it comes to starting my own center in Dubai, because I have been I have practiced in Dubai and I know how it is.
So I think the Icons Unplugged season 2 will be done from Dubai then.
Of course, I would love to do that any day.
Thank you so much, Hajira. It's been such a pleasure talking to you, and as a token of appreciation and a gesture, there's a small gift for you.
Oh my God, thank you, Fez. That's really sweet of you and from your team. And it was really lovely being here, and it was fun.
No doubt.
I didn't really feel that. I was very nervous. I really thought that I need a script and this is how it's gonna be, but amazing.
For a change, I wasn't afraid of talking to my dentist.
Like I said, by the end of the day, we all are humans, right?
No doubt.
Yes.
So this is a small token of our appreciation.
Thank you so much,
If you
Fez.
could open it, I'd be more than happy to see that expression on your face.
Oh my God, I love gifts. I love gifts. So of course, and I'm very eager. Yes.
Once you go black, you never go back. That's our favorite color.
Black. I love black. Oh my God, this is so lovely. This is so nice. Hydration. Now you guys know why I say hydration.
That's
And of
perfectly-
course, yes, Travel Freak. Thank you so much, Fez. And I would definitely use this. I don't know which handbag, but definitely. And a
this is
diary,
from-
of course. The diary is gonna be to pen down my personal thoughts.
Lovely.
I'm gonna hide it, especially from my friends like Fez.
Thank you. This is from Teams Unplugged, and really appreciate it. Also in your Coffee with Current Style, your autograph on this mug.
Coffee with Fez, okay. So nice.
Your autograph.
Thank you, Fez.
Thank you. It means a lot. Thank you so much. We are here